palpate for her lymph nodes, pre-auricular, post-auricular, tonsillar or jugular digastric, submandibular, submental, anterior cervical, posterior cervical, occipital, sorry.
I was ready.
Okay, straight your shoulders, supraclavicular. Okay, there's no lymphadenopathy. All right, I'm going to move on to the thorax and lungs. So I'm going to start initially, of course, on a real patient. I would have her undressed and look for any lesions or visual deformities. Her AP to lateral diameter is 1 to 2. There's no barrel chestedness. I'm looking at her respiratory rate and rhythm. She's breathing regularly without any use of accessory muscles, no distress. I'm going to palpate any tenderness over the ribs or sternum.
No.
Okay, and then posteriorly, any
Nope.
tenderness? Okay, there's no scoliosis or kyphosis or deformity. I'm going to do thoracic expansion. Take a deep breath. Okay, there's equal excursion. And I'm going to actually go ahead while I'm back here and do tactile fremitus, say 99.
99.
99.
99.
99.
99.
All right, the vibrations are felt equally bilaterally. I'm going to do CVA tenderness. Does that hurt?
No.
Does that hurt?
No.
All right. And then I'm going to do auscultation with the diaphragm for breath sounds. Take deep breaths in and out. Deep breaths in and out. Okay, lungs are clear bilaterally. It's mostly vesicular sounds in the lower fields. I'm going to do voice sounds, so could you say 99?
99.
99.
99.
It's muffled, so bronchophony is negative. Could you say E?
E.
E?
E.
E is heard, so egophony is negative. Could you whisper 99? 99? Okay, nothing's heard, so whispered pectoraliloquy is negative. And I'm going to percuss. Normally I would percuss the anterior, but I'm going to defer that. Make sure to get that right middle lobe. Okay, and she's got resonance throughout all lung fields. All right. I'm going to go ahead and move on to cardiovascular. I already did the neck veins and the carotids and the temporal arteries. So I'm going to start with the precordium. I would, of course, undress a real patient and inspect for any lifts or heaves. I'd palpate the chest for any thrills over the precordium. I'm going to listen in the 5 areas: aortic, second intercostal space, right sternal border; pulmonic, second intercostal space, left sternal border; Erb's point, third intercostal space, left sternal border; tricuspid, fourth intercostal space, left sternal border; mitral or PMI, fifth intercostal space, left midclavicular line. Would also palpate on a real patient for the PMI at that spot. So I'm going to listen for S1 and S2 with the diaphragm. And S2 is heard loudest at the base of the heart up here. S1 is heard loudest at the apex down here. And I'm going to listen now with the bell for extra sounds like S3 or S4 or murmurs. you have to lay on your left side. Okay. All right, you can sit up. She has no S3, S4, no murmurs, rubs, or gallops. I would also, in a patient, have her lay down and repeat the full assessment with the bell and the diaphragm in the lying position. I'm going to check now the peripheral pulses. Start with radials. +2 bilaterally, brachial. +2 bilaterally. Dorsalis pedis, +2 bilaterally, posterior tibial. I'm also noting there's no edema, extremities are warm. Popliteal, obviously I'm not really going to feel it very well through her slacks, but can't really feel it, but that's where it would be.
Hope it's there.
I'm sure.
Oh.
If you have pedal pulses,
Yeah,
you
yeah.
have to popliteal. Okay, so that concludes cardiovascular. I'm gonna move on to abdominal. So if I could have you recline.
Okay.
And I'm gonna approach the patient from the right. I'm gonna initially start with inspection. Again, I would expose the abdomen. And I'm looking for any distension, any obvious peristalsis, any lesions or scars or things like that. And for the abdomen, the next thing I'm going to do is auscultation with the diaphragm for bowel sounds in all 4 quadrants. Now I'm going to listen for vascular sounds with the bell over the aorta, the renal arteries, the iliacs. Okay, she's got active bowel sounds in all quadrants, no bruits or auscultated. I can palpate the aorta and note the width is about 1 to 2 centimeters. There's no aortic mass there. And the abdomen is not flat, non-distended. I'm going to do light palpation, so tell me if anything is tender, soft, non-tender in all quadrants. I'm going to progress now to deep palpation, feeling for any masses. Tell me if anything's hurting. I'm watching. Okay, I'm going to feel for the liver. I'm going to come under the rib cage, relax, take a deep breath in. Okay, liver's non-palpable, that's good. Come towards me just a little bit. I'm going to feel for the spleen. Okay, take a deep breath in. No splenomegaly, you can relax, it's non-palpable. I'm going to percuss the 4 quadrants. It's tympanic, that's normal. I'm going to find the liver border. You've got a tiny liver. Okay, it's up above, 1 rib above the costal margin. That's fine, that's just fine.
Oh, yeah.
Turn towards me.
Nothing to worry about.
Splenic dullness. Deep breath in. Okay, no splenomegaly. So the abdominal exam is normal. So if you could sit up. I'm going to move on to musculoskeletal. I'm going to start with overall inspection of the joints. There's no deformities, no erythema, no malalignment. So I'm going to progress to range of motion, starting with the neck, flexion, extension, hyperextension, rotation, rotation, lateral bending, lateral bending. For the shoulder,